and I'm really excited to have with me today Lisa Flanders and Sarah Trottier, who are absolutely amazing physiotherapists right here in the Ottawa area. And I'm excited. I'm always excited to dive into this topic. You ladies know that because you have so much amazing information to share. And I believe as mom and as women, like any of us women in society, we need this information. It's not something that we talk about enough. And so anytime that we have the opportunity to have these sort of chats, I always love jumping in on it. So before we get started, if each of you just want to introduce yourself and tell everyone a little bit about you and a little bit about your background and where they can find you for more information.
Yeah, so I'm Lisa Flanders. I'm a physiotherapist in Ottawa, and I am the co-founder of a clinic called Bloom Integrative Health and Movement Center, which Sarah is one of our fabulous associates at. And you can find us online at Bloom, oh my gosh, what's our email? Or what's our website? Hold on one second. Bloom Integrative Health. Integrativehealth.ca. Sorry about that.
COVID brain. It's COVID brain.
Yeah.
So much going on.
Go ahead, Sarah.
Oh, yes. So I'm Sarah. I work at Bloom, integrativehealth.ca. And I'm also a pelvic health physiotherapist as well. Yeah, happy to join you guys. This is fun. Doing something more than just relaxing by the TV.
I know. It's all about, our whole goal with this Mom Talk is try to get people still connecting and to be able to have, like, a lot of us who are moms and at home with their kids, we're spending so much time focused on how do we keep the kids entertained and how do we keep the kids socializing and kids. And I think it's really important that as women, we're taking time for us as well and to connect, whether, that's virtually this way or having FaceTime, wine dates with your friends or whatever it happens to be. We even the introverted introverts still need that human connection in varying ways. And I think it's really important that we're staying connected as we can. So for those who don't know, Lisa, can you maybe tell us a little bit about what is pelvic floor physiotherapy and what does a pelvic floor physiotherapist do?
Yeah, that's a really great question. So I think it's really first important to note that all the physiotherapists, so myself, Sarah, Andrea Plitz, and Natalie Morris, we're all pelvic floor physiotherapists, but we're also all like applied integrative physiotherapists. So what that means is that we don't only treat pelvic floor and we don't just treat the pelvic floor. So if someone comes in to see us, typically their concerns are related to things like pre and postnatal care, urinary incontinence, painful intercourse. Those are the typical concerns that we see, but we always take a whole body approach. So we always look at everybody from head to toe. And sometimes we might be treating something that is not directly, or what you think might not be directly related to your pelvic floor, but it's just how our body is connected and how it's created dysfunction in one place or another. So where our focus is going to be more of those like pelvic related concerns, that's not necessarily always how we treat, if that makes sense.
Yeah. So Sarah, what would you say for someone who's like, I've had a baby, I'm having no issues, should I still come see a pelvic floor physio?
Yeah, so I typically suggest every new mom to come in and see a pelvic floor physiotherapist just to kind of see where your body's at, because there's so many changes that happens to our bodies during pregnancy in itself and also postpartum. So we typically suggest seeing a pelvic floor physio after about 6 weeks. So you might see us first, you might see your midwife or OB first. But we usually give the body some time to adjust, heal a little bit, and then we start our treatments after 6 weeks, which is really great. And we look at the whole body. Like I said, there's so many changes that occurs not only to your pelvic floor with vaginal birth, but also with C-sections as well. So whether if it's vaginal birth, C-section, go see a physio.
So important. And I often hear, and I wanted to ask that question because I have so many women who will say like, oh, I have no issues. I'm like, still go. Like, we can be in tune with our own body and feel like we really know what's going on, but sometimes we need help to see things that we're not able to see or feel. And I feel like the more education we can get about our own bodies and the more we can work towards prevention. Talk to me a little bit about physiotherapy, Lisa, for older women. So, for example, I grew up with a mom who peed her pants. Hi, Mom, if you're watching this. It was, she had 3 kids. And so to me, it was just normal. You have babies, you pee your pants. And so, like, I remember going places and she'd bring extra pants with her, and because it was just normal part of living. So at her age of almost 60, I will hear people sometimes say, like, oh, like, pelvic floor physio is just for new moms. How does it work? Can it work? What are you seeing with women who are way past postpartum, like immediate postpartum stage? And how can pelvic floor physio benefit them?
Yeah, so we see a lot of women that are, 50, 60, 70, 80 years old. And we actually see a lot of really great benefits fairly quickly in that population because, we will start them on a program of functional movement, and their bodies typically adapt very, very quickly. That sometimes might also include recommendations from their medical doctor. So we might, recommend that they go talk to their medical doctor and potentially go on like a topical estrogen bioidentical type thing just to help with some vaginal wall atrophy. But I do find that I have such great success with that age group. And the really nice thing typically with women over 60 is they don't have young kids at home. So they can focus on themselves a little bit more. And they're a little more stringent about doing their homework and being consistent. And they sort of have that plan in place already for physical activity. So they just kind of tack on their pelvic floor health piece, and we see great results really fast. And I don't think there's ever a time where it's too late. There's never a time in your life where it's too late to build new muscle and build new muscle memory. So yeah, it's never too late. Let's put it that way.
I love it. And there's so many hormonal changes that are happening with that stage of life too. And that can affect things that are going on with their core and pelvic floor. Is that correct?
Absolutely. Yeah. Yeah. And so that's where we might bring their medical doctor or gynecologist in as well, and just sort of make our recommendations. And then they, we do work very closely with a lot of the gynecologists and medical doctors in Ottawa. So, for the most part, it is sort of that integrated approach.
Awesome. So as people are joining us, feel free to ask questions, and we'll ask Lisa and Sarah as we go through. If you have comments, anything, feel free to write them in the comments below, and we're happy to ask those. So Sarah, you teach a prenatal alignment class with us. Why do you feel it's important for women who are pregnant to start connecting with a pelvic floor physiotherapist? Because I think a lot of times the focus is on the postpartum. Usually when we're pregnant, people are focused on how big is my baby? Is my baby doing well? How am I going to get this baby out? How am I going to choose to birth? And then postpartum, people tend to think more about, okay, how do I get my body back to what it used to be? But we know that if that education and kind of training starts prenatally, that they're set up for a little bit more success afterwards. So why do you feel as a pelvic floor physio it's important for people to start during their pregnancy or maybe even before becoming pregnant? And what are some things people can be doing during pregnancy?
Yeah, no, start things off. I love teaching the course. Lisa started teaching it before, and then I kind of took over, and I love doing it. It's so much fun, and usually, the groups are amazing, and people tend to connect during it. So I just wanted to say that first. But, during pregnancy, I think it's important to understand how your body's changing and understand, okay, so as my baby's growing, what's happening in my body? So really trying to connect to your own self is really important during pregnancy because there's so many changes that happen. There's extra hormones. Our joints become there's more mobility in our joints because of the relaxin that's in our body that's affecting our ligaments. So there's a lot of changes, and with these changes, a lot of women during pregnancy will develop, lower back pain, a side joint pain. So it's important to understand your body. And the term physio alignment, that's our class. It's basically just trying to figure out, with all these new changes, how do you get your body? Is there something going on within that you can change or that you can work on so that you don't, experience all these issues? So what we tend to do is we educate a lot during this course. My first day, I talk most of the class, and then we try to really get in tune with our own body. So understanding how to contract your pelvic floor, but more importantly, how to relax your pelvic floor, how to engage your core properly. And our pelvic floor is part of our core system. So what we want to do is we really want to tune into those muscles. So your pelvic floor, your diaphragm, a lot of breathing, and you guys do a lot of breathing and activation there in your prenatal yoga classes too. But yeah, a lot of it is just trying to really get to understand your own body, understand your changes, what impact can these changes have on your body, and just learning from it. And I think it's really empowering to see women start at the beginning of our class not really knowing a whole lot, and then at the end they're like, whoa, look at my pelvic floor, and you can see these lovely changes. And the class isn't necessarily like a one-on-one where we're doing a lot of treatment, but if I'm seeing someone who's having maybe a lot of back pain in our class, oftentimes I will recommend continuing care one-on-one. And we typically do recommend going to see a pelvic floor physio at the beginning of the class so you can really understand how to engage, how to contract. Because if I tell you, hey, squeeze and lift the raisin with your urethra, a lot of people are like, what's going on? So, so it's good to really understand and really connect your whole body. And then we teach exercises for, perineal release, perineal massage, and, education is the biggest part, I think, too, is just making sure you understand everything.
I love it. I think, and it's the education that I really wish they would teach in the high school, girls' health gym class.
Yeah.
It's the important stuff. I mean, I remember in high school now, that was a long time ago, we learned about our menstrual cycle and we learned how not to get pregnant. That was it, right? And so, but when you think about, I've had women say, if I have a catheter, how do I birth my baby? And I'm like, you have 3 holes down there. And it's not in a condescending way, but it to me, it was really eye-opening of, wow, we still have a lot of education to do to teach people about their bodies. And this is general health stuff that should be taught to our kids. I mean, I think my 9-year-old son probably, he's heard the word pelvic floor and vagina and vulva, since he was born. So to him, now he's like, oh, Mom. But it's normal conversation around here. And I think if we're not teaching people from a young age, I think people are then intimidated. They have a baby, they have issues. They're told, oh, go see a pelvic floor physiotherapist, and we feel shy or embarrassed about our body, or how did my body fail me, or what's going on with my body, because these aren't terms and things they're used to hearing. So I love that people like you ladies and your team and many others in the Ottawa area, and we're seeing it across Canada and the US, that there's more people helping to educate the general public so we can really make this mainstream, because I think it's important that we're doing that across the board.
Mm-hmm.
I often have people in our yoga classes who will come and say, oh, I have so much back pain because baby's growing. Lisa, talk to us a little bit about what are some common things you see in pregnancy with people coming with back pain, issues with the hips. What are main issues you're seeing, and how can you ladies as physiotherapists help people reduce the pain that they're having?
Mm-hmm. Yeah, so very common during pregnancy, low back pain, pelvic girdle pain. So any sort of pain in and around the hip area, and then pubic symphysis dysfunction. Those are very common pregnancy related concerns we hear. So I mean, lots of different things that we can do. Obviously, we want to find what's driving that concern. So what works for one person, like a belt might work really well for one person, is not going to work well for someone else. And so kind of determining what's going to work best for that person or what that person needs. So, I mean, again, this goes back to like pelvic floor core training, where our pelvic floor really is such an integral part of our deep core system. And there a lot of changes are occurring. So, we're definitely going to start with some education in terms of like core activation and a little bit of movement to be able to support the changing body. We talk a lot about posture changes and things to be aware of if you're noticing like different changes in your posture, what you can do to help reduce that sitting at work, and how that's going to help you. And then, I mean, we do, often do manual therapy, but not always. Like sometimes it's just a matter of some positional help. And then, maybe yes, no, might be a belt, might be taping, might be like different things that we like, different creative ways to tape someone, which is usually pretty easy to show a partner, either by video or doing a recording. So that's sort of how we work with a pregnant population.
Do you find often it's some general lifestyle changes of posture and how they're sitting and those sort of things that can have a great impact with them if they come see you early on?
Oh, absolutely. I find that like sometimes it's just that those general lifestyle things that need to be adapted to a changing body. And if we can get those, change those habits fairly early in the pregnancy, then like really good results going forwards, as opposed to like sort of doing something not super comfortable, sitting, in a way that's not super comfortable for 3-4 months, and then coming in when you're 6 months pregnant and you're in like a considerable amount of discomfort.
Okay, so you mentioned a belt. I'm curious because it's, I see in a lot of the mom groups and stuff, people are like, oh, just buy this belt, buy this belt, buy this belt. And I always say, go see a physiotherapist. What are you, my feeling is that it's great that people are going to use belts to help them, but I feel like they're not necessarily using them properly or understand how to put them on. So what happens when someone gets a belt and doesn't know how to use it properly? What can they be doing to their body then? Or why is it important to connect with experts like you to learn what belts or equipment that they might benefit from and how to use them properly?
So, I mean, belting is very, very individualized. So you have to keep in mind that when we really stabilize one area, so if we're stabilizing the pelvis, something else is going to have to move more, right? The joints above, the joints below are going to start having to move more. So because you have pain in your pelvis doesn't necessarily mean that the pelvis is what's driving the pain. So if now we're compressing it, we're essentially making whatever is driving that pain have to work more, move more. So, I mean, really until you've been assessed, there are lots of people that will feel better with a belt. And if you feel better wearing a belt, that's great, wear your belt. But if you're like, well, the belt's not really helping, then that's kind of your indication that maybe I should come talk to someone, bring the belt in, because maybe we can adapt it or show you how to use it properly, and try to help you at least with what you've purchased first. But yeah, I mean, you always have to keep in mind that every time we stabilize a joint, something else has to move more. So if you're stabilizing a joint that maybe doesn't need to be stabilized, that something else needed to be, strengthened, then you're not going to feel a lot better.
Yeah.
I love that. That's great advice.
I also had sorry.
No, go ahead.
No, I think it's wonderful because like I had a client who brought in a belt and it didn't help stabilize. She didn't need stabilization there, but it gave her that like confidence of like, okay, I can move better. But like the next appointment after we discussed education, posture, when you're sitting down, all that kind of stuff, she came in and she's like, I'm not even using the belt anymore. Like my pain's much better. It doesn't help. And it was because her issue wasn't happening there, but we educated her on how to move properly, and then she didn't need it anymore. And so she was like, I spent $80 on this belt. But
as women, especially during pregnancy, when it's our first time, there's so many unknowns and unsure. We need that reassurance of you can do it. Like be confident in your body. If you feel like something is off, then something is probably off. But if you feel like, you feel well and you feel healthy and you feel strong, I think sometimes society is like marketing us so many things we have to have during pregnancy that we don't maybe necessarily need. And so it's nice to be able to connect back to experts like you ladies for that reassurance sometimes, just of, no, like your body's doing well, you have great alignment, you're strong, there's, you're doing a good job. And sometimes it's all we need to hear. And it also helps build that trust as well. So, you're there and we can come back to you later on as needed. Talk to me, Sarah, a little bit about, we're talking about belts, but talk to me about like belts postpartum or belly binding. So we still see a lot of like traditional belly binding. What are the pros and cons of that, and what should people be aware of?
Yeah, so a lot of women postpartum will get a belly binding belt to allow so that their muscles will come back together. So basically what tends to happen during pregnancy is a diastasis rectus abdominis, or DRA. And basically it just means the separation of our six-pack abdominal muscles. And basically it happens during pregnancy to allow the baby to grow. So after birth, most people,
right? Like I think a lot of people are like, oh my gosh, my abdominal wall, like it's separated during pregnancy, but it's very common during pregnancy, right?
It's very common. And I think I read a couple months ago, it was 66% of women, don't quote me on that or anything, but I'd done a little bit of research on it just to see what the percentage was. And it's, it's something that's natural that your body's going to do. So let's say during an assessment on a woman who's pregnant, and we assess for, okay, what are your muscles? What's your pressure system wanting to do? It's not about fixing it. It's more about educating people on how not to make it worse and how to move properly, how to engage their core properly. So then after birth, if let's say the muscles didn't go back together, there's a lot of things that we're looking for. We're not necessarily only looking for how far apart your muscles are, but we're actually looking to see how much tension can you build when you're lifting something up, lifting the baby in the car seat, getting up from bed. How much tension can your tissues build so that everything can kind of, maintain properly? And a little bit of anatomy while I'm talking about tension. During pregnancy, what actually is happening is it's not the six-pack muscles that are like tearing apart. It's the tissue that's in between your six-pack muscles called our linea alba that will actually separate. And the linea alba is basically like a nice bridge that helps transfer our loads from side to side. So then let's say after birth, you still have a little bit of separation, but every time you do a head lift, every time you do a functional task with lifting, you're getting really great tension through that linea alba. Like a bridge, you want a strong bridge. You don't care how large the bridge is. You want it to be nice and strong. So we focus more on functionality. How much tension can you build? So when people, bringing it back around to that band, when people use bands, are they just using it to keep things together, or are they working on trying to build that tension? Are they trying to work on their core in order to maintain that functionality and that tension through those tissues? Because if you're just using a binder just to kind of like hold everything together, if you're not doing any work to help with your strength and that tension, then it's kind of like, well, what good is that doing?
Would it be fair to say that people who are using belly bands postpartum, if they're not doing the work, they are possibly just making things weaker for their body?
I think that it's a functional approach to things. If you're not working on your strength, like how is everything supposed to come back together if you're just holding it together? Some women do need that extra compression to be able to stabilize. So as long as they're working on their strengthening, you can get compression shorts. Some people will use like those high-waisted, nice and tight shorts just to hold them in a little bit. Sometimes they might need that response to it, but I think getting assessed is definitely a better way of doing things rather than just depending on a band to hold everything together.
Perfect. Thank you. Lisa, talk to us about working out and core and pelvic floor. We're starting to see a shift again, a little bit more in society, a little bit more towards, there's been like a swing in the pendulum. For years, it was don't lift weights, don't do sit-ups, don't do planks, if you have diastases or pelvic floor issues, basically don't do anything. And now we're seeing, you know, a lot of these things can be safe if done properly and with the proper education. So do people need to be fearful about working out? And how, you know, what are some tips you would give people who want to get back to CrossFit or lifting or those sort of workouts?
Yeah, so yeah, there has been a really big shift, and just touching on a point that Sarah talked about, how it is a matter, we're looking for like tension building and strength building. We don't build tension doing nothing, and we do have to build tension in multi-planar directions. We need to move forward, we need to move sideways, we need to do rotational stuff to definitely work on our linear elbow, and like, sorry, I'm holding something in my hand, in all these different directions so that we can make it stronger. Our body really does adapt to the stresses that we place on it. So going back to like our plank safe postnatally, it really depends on the person, because person A, who can generate tension very well through their abdomen, yes, planks are going to be maybe a good exercise for them. For person B, who needs a little bit more of that core training in just a little bit of a modified direction, is going to maybe not be doing planks right away, but doing plank-like movements. And I actually did a really good Instagram. Well, Sarah actually demonstrated some different ways to do planking on Instagram today. So in 4-point, and then doing actual planks too. So check that out. So getting back into things like fitness and functional fitness and CrossFit and weightlifting, you know, you kind of have to keep in mind like what your body went through. So if you've now taken 6 weeks off of any activity for any reason, whether it be like surgery or you've had a baby or, you know, you have a broken ankle, you're going to have to go back into it in a modified direction. And so that's the one thing I always tell my CrossFit ladies is like, big thing, check your ego at the door. But yeah, go back and do some of the movements, and we can help you modify the movements that might not be appropriate for you at this time, and what movements will be appropriate for you at this time. And it's very much just the beauty of what I think all physical activity is that it's infinitely modifiable, it's infinitely scalable. And, you know, maybe you're not running a marathon now, but doesn't mean that we can't get you running and doing, you know, a task that you enjoy. And that's a big thing with all of our physios, is we really want you to be active, and I want to know what you enjoy doing so I can help you be active with what you love doing.
Which I think is so important too for mental and emotional health.
Yeah, it is.
Right? Like, 'cause some people identify as a runner. They're like, I need to run to feel sane. Like, yes, I love how I feel in my body being physically active, but like in my mind, it helps me feel sane. And so those people, it's important that they're able to come and see you and to figure out, how can I get back to running as soon as possible, and what modifications need to be made, or what other, you know, movements or things should I be doing as cross training to help me when I'm running, because that's what's going to help their mental and emotional health. For years after I had my babies, I was like, I can't do any of those things. I have issues. And I love to lift. I love to lift heavy. I love boxing, like all those types of things. And in my mind, I was telling myself for years, like, I can't do that. I'm just going to make it worse. And it wasn't, and it was you ladies. We all took a course together 2 years ago, a year ago, 2 years ago. And it was the first time that I went back to like really deadlifting heavy. And I was like, I feel so good. Like, it feels so good for your mental, emotional health. And I love that, you know, you're helping women bridge that gap in a safe way. And that we're coming back to educating society that those things are safe when done properly. So, and you guys have, I mean, COVID aside, when it's all over, you have like gym equipment and things at your clinic, correct? So you're able to help people one-on-one and in those settings if that's something they're interested in doing. Is that how it works?
Yeah, so we have like a private, we call it a private gym, just meaning it's like a small space that we do have a gym, and we have a squat rack. We have weights. We can get people up to squatting 235 pounds, which is fantastic. Squatting, deadlifting, if you want to work on, you know, barbell cycling, we have kettlebells, so that we can actually watch what you're doing, make adjustments, and help you do the things that you want to do. So a CrossFitter coming back in, I'm not going to get them back to doing snatches right away, but we can, do those types of like overhead movements or presses, like things that do sort of require similar tasks, and in a safe way. And I mean, I don't get everybody to come in and lift 235 pounds. We just happen to have that weight available because we do have some pretty intense powerlifter clients that needed it. So I was buying enough weight. We bought enough weight to make sure that we could to match those clients' needs. But yeah, and then going back to that course that we took, Amanda, where you hadn't really deadlifted in however long, and then you went and like were the strongest person there. And I was like, years, how she was beaten.
It had been like, I mean, I hadn't deadlift heavy like that for like probably 11, 12 years.
Yeah, and I was just like blown away. I was like, oh, see this, you just need like that confidence that you can do it.
I just needed someone to be like, you can do it. And we're a room of physios. In case you screw up, we'll tell you what you need to do to fix it. Like,
yeah, absolutely.
But I grew up, my dad was a bodybuilder. I learned to bench press when I was like 3 years old. Like I just grew up. Every night after dinner, we'd go down to the basement and we'd lift weights. That's just what we did. And so for me, it was just always part of my lifestyle. And it was a lot of mental, emotional health as well. And so when I had kids, it was like, can't do that. So it felt so liberating to have the permission, because I, for some reason, couldn't give it to myself. And so I always tell people, like, if those are your, like, nothing's off the table forever now because you've had kids. You just need to find the right resources and the right people to help you bridge that gap so you can do the things that you love to do again.
Yeah. And that being said, yes, obviously our clinic is temporarily closed down to the public. But that being said, a lot of what we do when we do like a gym, I call them gym appointments, is hands off. So, we can still do that virtually. I can tap in with you through Zoom and Sarah can do the same. We can have a full appointment with you and go through exercise in a hands off way so that you can still be healthy and happy.
I love it. So that's a good kind of bridge into your clinic physically is closed, but virtually you are like full open there to support everyone. So how can they do that with you, or what sort of appointments are you doing virtually for the next however long this lasts?
Yeah. So we physically have closed. We made the decision last Sunday. We felt that it was our social responsibility to follow Ottawa Public Health's guidelines. So what we have done, and we were planning on doing this before, so we had started it. Sarah had done a ton of
boost, right? Someone said to me like, "Oh, you're doing classes online." I'm like, "Yeah, I just needed a kick. Like I needed a like have to." Yeah, so we've essentially at this point, so we closed this week. We took this week to sort of like brainstorm and have like some team meetings and whatnot. And so what we're doing is, as of Monday, we are going virtual. So anybody who's in the schedule currently is going to be converted to a virtual appointment. And obviously there's a little bit of, we're going to keep your appointment times the same, but if we don't use that whole appointment time, we'll adjust the fee. And this is going to be a really great way for people to continue with their programming. So it's going to be a lot of education, rehab, exercise rehab, movement, ensuring people are like breathing properly. So this is going to be like a great way for you to still continue with your programming and your physio rehab without actually having to come into the clinic. Which I think is going to be that little nudge that some women need to feel empowered in their own body, right? Of like, I am capable. I don't, yes, it's amazing to have the resources to come in face to face with you and for manual therapy and manipulation. But you're right, there's so much that people can be doing at home with your guidance like this, still face to face. I think people are going to start to maybe trust their bodies a little bit more and know I am capable of doing these things with guidance, but not having someone physically sitting there right there beside me.
Yeah. And I think a really important thing to note is that everything that we're going to be doing virtually are all things that would be included if you came into the clinic, with the absence of the actual hands-on manual therapy. But that doesn't mean that it doesn't mean that we won't also be showing you how to self-treat manual therapy. And there's a lot of great tools to be able to do that. I mean, again, yesterday on Instagram, we had a little post about like, if you don't have this at home, use this. So, I mean, these are all things, this is like your regular rehab minus the hands-on. So more education, more movement focused.
And more independence as well. And
Yeah.
I find it also helps empower people to take care of their own, whatever they're like if they're in for back pain or leakage or anything like that, it empowers them to take hold of their own conditions. Yeah, I think it's great.
And we were talking about this a little bit before we went online, is that people who have maybe been like, oh, I don't have the time to get to the clinic, or it's hard with kids at home to get there. This is now their opportunity. We're all at home, social distancing. You don't have the travel time back and forth to the clinic. So now's the time to get an appointment, because we have more time than ever at home to do that. So anyone who's watching, who's at home thinking, oh, I should have made an appointment, or I've been wanting to make an appointment, make that appointment now and connect and do it virtually. I think it's a great opportunity and really makes it more accessible to everybody.
Mm-hmm. Yeah. And we're really, I mean, we have been working on launching this for the last month and a half or so, because we actually originally wanted to connect with people that were not in Ottawa, that lived outside of Ottawa, that might not otherwise be able to access care. And so this just kind of was like our extra push to offer it now. And it's going to be fantastic for women in that early postpartum period going forward who, are feeling overwhelmed about leaving the house, but they want to do something. So this is going to be a great way for them to connect with us and get them moving sooner. And so that they're not feeling like, oh, I'm sitting around doing nothing and I'm afraid to go out with all this, whatnot. Yeah, so it's a really great opportunity, I think, for us to just launch into a different type of, an alternative type of care.
I love it. Thank you so much to both of you for being here. I know you mentioned a few clips and stuff that you've shared on Instagram, so if you wouldn't mind popping them later in the comments below of this live, so people are able to see them, and as well as your website, so people know where to connect with you for more information if they want to set up an appointment. I know you have lots of resources on your website as well. And so thank you to both of you for being here. Thank you for being a part of our community. I think it's so important to have resources that us as women are able to tap into. And you guys continue to show up all the time in the community, and you're there to provide those resources. So from all the women, I thank you for doing that. And you're really the leaders in the field. And I think it's really important that we continue to have those resources. So
yeah, thanks for having us.
Safe, social distancing, and loving all the virtual.
Yeah.